Did I pause? Thank you everyone for hopping on to our webinar. Please go ahead and put your name and agency in the chat. I know some folks are getting back from lunch or maybe on lunch, so please feel free to turn off your camera. No worries here. And then please, again, let us know your name and agency in the chat, and I will go ahead and pull up our PowerPoint. And then just wanting to double check that our presenter is here. Julia, are you here? Or Julie, you are here. Great.
I don't know. Multidisciplinary.
Is it a meeting or a webinar? I think it's a training.
So, folks, for everyone who's jumping on, this is our multidisciplinary approach series to ending homelessness. Our continuum of care puts on these monthly webinars on different topics that affect folks in our community. Thank you to my team who's on and muting folks. Much appreciated. So again, folks, just to reiterate what this is the multidisciplinary approach series to ending homelessness, put on by our continuum of care. Some of you all have probably attended previous webinars, but we put on these webinars every month and hope to really assist and support our providers and our agencies with information that will hopefully serve the clients. This topic is Medi-Cal renewal for people experiencing homelessness. And so I'm sure a lot of providers have experienced barriers to getting, clients, especially when they don't have stable housing, right? And getting that Medi-Cal, and now that folks have to renew every month. And I'm really excited. Julie will have all the information, why it's important, what are these changes, and how does it affect us as providers and our clients. So I know folks are still rolling in. We'll give it one more minute. And again, we do record these and they are posted on our website. How do I? Can everyone see my slides? Awesome sauce. Alrighty, folks. So our presenters will share their slide after a few slides that I have, just introducing, welcoming everyone. So hi, everyone. I am Monique Guerra. I am the Homeless Youth Coordinator here with our COC, and I also facilitate these webinars. And so welcome, welcome. Thank you all so much for taking time out of your day to come and gain some knowledge that will hopefully better assist your clients. We are excited to have everyone here today and our awesome presenters. Again, the purpose for our webinars is really an opportunity to engage with folks, learn new items, and then hopefully address any specific need in the community. So if folks do have any suggestions for future webinars, you can definitely send it to coc@rivco.org. feel free to send it to myself as well if you already work with me and you have my email. And I'd be happy to either find a presenter, or if you have a presenter, I'm happy to reach out and see if they'd like to present at one of our webinars. And again, these webinars are recorded and they are placed on our website. And Gershom, who's on our team, is awesome. And he's going to go ahead and post that. And then we'll send the recording afterward so that everyone has that for reference. This is our quick agenda for today. We're going to get started here in a few minutes, and I'll go ahead and pass it over to Julie and Carla, and if they would like to share their slides. If not, I also have the slides, up to you all, ladies, and then we'll leave about 10 minutes at the end for questions, and I will pass it over to our presenters.
Thank you, Monique. Go ahead, and if you don't mind me saying, move on, or next slide, it'd be awesome. So first, just want to introduce myself and my colleague, Carla. I'll let her introduce herself. We're from Home Base. We are a nonprofit organization that has worked to end and prevent homelessness for over 30 years, closer to 35 years, I think. We are primarily, we're doing our work in California, but we do a ton of work now outside of California. We're a HUD TA provider as well as a local TA provider here in California. And what that means is that sometimes we get called into a community to do strategic planning or to help them do a COC evaluation. And then other times we work shoulder to shoulder with the COC. So we have annual contracts where we work day to day in communities, providing them support and sort of filling out the holes in staffing when there isn't a obvious full-time position, but there's a lot of things that they need. And so they come to us and we can fill out a lot of those pieces of their puzzle. We have always worked at the intersection of healthcare and homelessness, but more recently, in the last probably 8 to 10 years, we've been doing a lot of work around cross-sector work. And probably the last 4 or 5 years, as a lot of it has been focusing on data sharing, how to create cross-sector work, the opportunities around whole person care, and then more recently with CalAIM and HIP, which we'll talk a little bit about today. And why we're here is because we're sort of in a, I don't want to say crisis, but a important moment in our history around cross-sector work that we want to make people who work within the homeless system aware of, because people are going to fall through the cracks. So I'll talk about that in a minute, but I want to let Carla introduce herself really quick.
Thanks, Julie. Thank you so much for having us and for allowing us to be featured speakers today on the series. And I will be looking through the chat, so if folks have questions, I can call those out to Julie at the end, or however you want to do it. But thank you for having us.
So great. So I'm fine with interruptions. So if you want to ask a question in the chat and Carla pulls it out to get clarifying questions or questions in real time rather than wait till the end, feel free to do that. But what we're here today is to talk about Medi-Cal renewals and the unprecedented moment we're in right now because of COVID. So next slide. This slide I put up on the screen. It's kind of our agenda, but I have a mission, which is I hope by the time we're done with this conversation that you all will each be able to take this slide and take it with you where you go, and you'll have the tools and you'll know what the messaging is to use this slide to bring this awareness to people who aren't on this call. So if you have staff meetings, if you're part of other community meetings that happen, and there's an opportunity to talk about Medi-Cal renewals, especially around how they impact people experiencing homelessness. This is a nice compact slide that you can then take with you when you go to those meetings, or use it as a way in your staff meetings to help people understand what you're learning today. And basically it has two pieces. The first piece is why we're here talking about it, that after 3 years, suddenly now people who've never had to experience home renewals for Medicaid, Medi-Cal are having to do that. that millions of people are going to be affected by that. And there's ways that you might be able to help prevent people falling through the cracks and losing their health care coverage. So that's like the 3 points on the left side. And on the right side is how you can help spread the word. Again, use this PowerPoint, at least this first slide, to get information out to your staff and other meetings you have. You can offer your mailing address, which we'll talk a little bit about later. And then you can encourage people. We have a big webinar coming up next week where we're going to dig a little bit deeper, have some speakers come in. DHCS will be on the call talking a little bit about how they're approaching homelessness, particularly people experiencing homelessness and renewals. So that's my agenda, and we'll go dig deeper in for the next slide. Go ahead. So this is Medicaid basics, just to make sure everybody understands and we all understand what we're talking about. Medicaid is a federal health program. It's a public program that covers low-income families, individuals, seniors, youth, people with disabilities, pregnant women, etc. In California, it's called Medi-Cal. And there are almost 16 million people in California who have Medi-Cal. And basically, I think it's the largest health insurer of children in California. The special thing about California's Medi-Cal program is it's more expansive than other Medicaid programs for two kind of big issues. The first one is that it's covered and has been covering people who are not immigrants in California who are under 26 years old. So in many states, if you don't have legal present status, you're not entitled to get health insurance through Medicaid. But in California, if you're under 26, you are. And if you're over 50, you are. The California for 26 has been for a while. 50 is more recently. And the really cool news is that starting in 2024, regardless of age, people who don't have immigration status will still be able to get low-income health coverage. So that's a really big, expansive. It means there's a lot more people eligible here in California than in other states because we don't look at immigration status for eligibility. And it's really important. Another important and expansive program is the Cal-AIM program, which is a new initiative under Medi-Cal. So we'll go ahead and change to the next slide. The Cal-AIM program is a new program that officially started in the beginning of 2022. And it's a program that is very expansive. It came under what we call a federal waiver, an 1115 waiver. And basically what that is that the federal government says, here's what our Medi-Cal program is. If you want, Medicaid program is, if you want to do something that accomplishes everything we're trying to accomplish and doesn't limit it in any way, but expands it, we will allow you to do a pilot program or a waiver, and we'll waive some of our rules and let you do more expansive, as long as you're making sure that people are not getting any less than they would under the traditional federal program. And so states often use this as an opportunity to create creative programs. Oftentimes the creative programs that happen at a local state are so successful that the federal government embraces those, and then they become federal rules and federal programs. So this is one that happened, and it's basically extended pregnant women's coverage for longer. It has new coverage for people transitioning out of correctional institutions. It has more robust coverage for people with behavioral health issues. Two of the main ones that went into effect immediately were under housing related services, or were particularly targeted for people experiencing homelessness. And the first one is enhanced care management. And that's a program that all counties have to include in their Medicaid program. And basically what it does is it acknowledges that people with complex care needs, in particular people experiencing homelessness, have a very challenging time coordinating their own care and making sure that all their needs get met. Sometimes they have duplicative services. They can't keep track of what's going on. Their medical situation is frail. Or for people who are living in encampments, they're afraid to leave their belongings behind or their pets behind in order to go to a medical appointment or to get their care management. And so this this particular aspect of CalAIM, Enhanced Care Management, basically funds care managers to kind of help people manage their care, make sure they're taking their medications, getting to their appointments, that there's no duplication, that there's no repeats, et cetera, et cetera. And one of the unique aspects of that is that they have to go where the person is. So instead of requiring someone experiencing homelessness to go to a clinic to get their care, the clinic is supposed to go to them, or the enhanced care management provider is supposed to go to them so they can provide care management at their home, they can provide care management at the shelter, and they can provide care management where the person is experiencing homelessness on the streets and encampment by a river, et cetera. So this is a really important new benefit that has the potential to really help ensure that people experiencing homelessness, healthcare doesn't worsen because of their homeless status. The other really important new set of benefits are called community supports. And they are a set of 14 different community supports that each managed care plan had the option to provide. And every single managed care plan has opted to provide these, but not all 14 of them. Each one has decided which community supports they're going to provide. But all of them, as far as I understand, are offering the 4 ones that are most important for people experiencing homelessness. And they're housing related services, housing navigation is one of them, housing tenancy and supports, housing deposits, and post-hospitalization short-term housing. And those are all really important because what that means is Medicaid, Medi-Cal, is paying for providers to offer these services to people experiencing homelessness. So instead of using your HUD funding or your ESG or your CDBG or HAP funding, if your client is enrolled in a managed care plan and they meet the requirements, the managed care plan will use Medi-Cal money to provide them housing deposits or to provide them housing navigation. So why am I telling you all this detail about CalAIM? Switch the slide because we're going to talk about Medi-Cal renewals. Next slide. People on Medi-Cal are entitled to those CalAIM services if they're eligible. But if they don't have Medi-Cal, suddenly not only are they losing those services, but as a COC, you all are losing the access to those resources that the healthcare system will pay for instead of the COC or the homelessness system. So there's 2 really big reasons. And we're in a new place because renewals for Medi-Cal are starting to happen again, and those are coming in the mail, and not everyone has a mailing address. So let's go to the next slide and talk about what renewals look like. So for the last 3 years, during the public health emergency because of COVID, the federal government prohibited states from requiring people to renew their Medi-Cal. What that means is since 2020, everyone who was on Medi-Cal had continuous coverage. That means they didn't have to prove to Medicaid every year that they were eligible. They didn't have to show that their income still made them eligible. They didn't have to show that their household size made them still eligible. If they were enrolled at the time the public health emergency was declared, they have had and have continued to have Medi-Cal. Many of the people you all work with maybe only have had Medi-Cal during that period of time, so they've never been through a renewal. Suddenly, the public health emergency is lifted, and now everyone who's been enrolled in Medi-Cal has to renew. And they have to renew. Everyone who's been on for the last 3 years who hasn't had renewal all have to go through a renewal for the first time for many of them. The other big issue is the campaign federally and also in the state is conditioned on receiving a renewal package in regular mail or at a last known address. So what that means for people experiencing homelessness, if they don't have a regular mail, they won't get the renewal packet and they may not even know they have to renew, especially if they haven't had to renew for the last 3 years. It also means for people who were experiencing homelessness in the past, but who have found permanent supportive housing, rapid rehousing, found an affordable home that they've been able to move into. If they were not aware of renewals, they may have failed to tell Medi-Cal, hey, I have a new address. This is my current address. If you mail my renewal packet to me where I was living when I first signed up, I'm not going to get that. So there are not only people currently experiencing homelessness, but anyone who has had a break in their housing and is in a new housing situation. If they haven't known to renew their contact information, they are very likely to not get their renewal packet. What does this mean for Californians? 2.3 million people of that 16 are likely to lose their Medi-Cal in the next year, which is a lot of people. And almost half of them, 1.5, maybe more than half, are still eligible. That means that they are losing their Medi-Cal not because their income is too high or their family size has changed, but for some kind of procedural issue. Maybe they didn't get their renewal packet. Maybe they didn't understand the renewal packet. Maybe they didn't get it in on time, or they lost it, or their documentation they have to provide wasn't provided in a timely manner. And for many of them, they don't even know about this. And so they might not find out about this until they go to the doctor and find out they don't have health insurance. Next slide. So you can see why we're here. What's at stake for people experiencing homelessness? Not renewing, they lose health coverage, and they lose all these housing related supports that they had access to through the CalAIM program, right? So not only do they lose health coverage and their health is at risk, not only do they lose access to healthcare funded housing deposits, housing navigation, but the COC loses access to these really important resources. Because let's say I'm on Medi-Cal today and I need housing navigation. My managed care plan funds my housing navigation. If I lose Medi-Cal, suddenly I need housing navigation and the COC has to be able to provide it to me. So it's a resource that's really important to individuals, also you all as a community. The other really important thing to think about is the idea of churn, which is when people go on and off of healthcare coverage. It can really have detrimental effects on people's health and well-being. It's disruptive. It results in poor outcomes, the lack of follow through. Oftentimes people lose that coverage, they get sick and they don't come back until they're sick. So they're in much worse shape when they finally do get health coverage. And the ideas of prevention or ongoing stabilizing healthcare conditions really is at risk for people to go on and off. And you saw 1.5 million people may go off, not for any good reason, but for a procedural reason. It also increases healthcare costs. It's harder and takes more resources from the system to have people reapply for coverage than it is to renew them. And then again, it's higher healthcare costs because if they're not getting care while they're off Medi-Cal and then they come back on, oftentimes they have more acute conditions that are more costly to cover. So as you all can imagine, for those who are working directly with people experiencing homelessness on a daily basis, the risk of losing coverage is much higher because of homelessness, and the risks associated with losing coverage is much higher for people experiencing homelessness, just because it's so much harder to live healthy lives when you don't have housing. Next slide. So the unique challenges for people experiencing homelessness and why we're here today is because the campaign really focuses on the assumption that people will receive these renewal packets in regular mail at their last known address. And so it's very difficult for people who have lost their housing to do that, whether they've gained housing subsequently or not, but particularly for people who are currently experiencing homelessness. And what it means is they won't not only get their renewal packets, but let's say they were automatically renewed, they won't know that. They won't get notices. They won't get reminders about their right to appeal. They won't know any of that. And especially for people who use languages other than English, often these renewal notices that come in the mail have what they call Babel language, which has language in the threshold languages in your specific community of majority of people use. So Spanish, Hmong, Chinese, anything that is there that helps people know this is an important package. I need to get someone to help me read this, or I need to reach out to the local office to get this translated. They won't know that as well. So there's a lot people are missing from this. So that's why we're here today. And the next slide is really focusing on what you all can do. There are 2 special rules. Not every state has these special rules. California knows that there are a lot of people experiencing homelessness on Medi-Cal, and so they are focusing and they ask the federal government to give them the ability, what's called a federal waiver, to create these special rules to help people more easily renew their health coverage. And one of them is for people who are very low income. So that definition is if they have 0 income or they have 100% of the federal poverty income or below. And what they decided was they don't have to complete a renewal package. If the state and the counties has information about your clients that they only make 100% of poverty or below, or they have no income, which is a lot of people experiencing homelessness, they are supposed to look on the databases that they already have and the information they already have about someone and automatically renew them so they don't have to fill out that renewal package. It's kind of a big deal. When we first started talking to DHCS about this and raised the big concerns, they said, well, you still have to renew this, but you won't have to prove your income. So you still have to fill out the renewal package, but you don't have to prove to us that you're 100% of federal poverty or below. We'll just base that on what we already have. But now they changed that. They did some work. This is a new ruling that will go into effect at the end of this month. So I think it goes into effect on Friday, the 29th. I think that's Friday. And after Friday, anyone who is 100% federal poverty or below, or Medi-Cal has information that they make 0 income, they should be automatically renewing them based on the information they have and sending them a renewal letter in the mail that says, hey, good news, you have Medi-Cal for another year. Kind of a big deal. Kind of a very big deal. And while this is supposed to help people experiencing homelessness, there are a lot of people on Medicaid who are low income who aren't experiencing homelessness that this is going to help too. The other rule, and that first rule is the person should not have to do anything but get that piece of paper that says I'm renewed, yay, and tells them when the next renewal period is. The next one, there's some activity that has to happen by the person experiencing homelessness. If the county knows they are currently homeless, the county, instead of asking them to do a full renewal packet, is supposed to reset their renewal date to a further date out a year from when they find that out. So for example, Julie, I am supposed to renew in December 2023. My year date, everyone has a month that they have to renew. There's different people renew every month. So every month they send out 1.25 million renewal notices. And so by the end of the year, that's 16, they've sent it out to all 16 million people. So mine isn't due. I won't get my renewal. I'll probably get my renewal maybe the end of this month, early next month, and I'll have to do everything by December. If they find out I'm currently experiencing homelessness today, September 24th, 26th, the county is supposed to restart my renewal period so that I am automatically renewed, or I don't think they just restart it. They're not calling it automatic renewal. But what they say is, oh, if you're currently experiencing homelessness, you don't have to renew until September 2024. So the month they find out that I'm currently experiencing homelessness, they can restart my renewal period so that it's not due till September 2024. If I go to them in October and tell them I'm currently experiencing homelessness, they should restart my renewal so that it doesn't start again until October 2024. If I go to them on November 15th in 2023 and I tell them I'm currently experiencing homelessness, they should restart my renewal so that it's not due until November 2024. So basically restart for a year. For people currently experiencing homelessness. The key one in that is the person experiencing homelessness has to tell Medi-Cal that they are currently experiencing homelessness. I'm going to stop here and take questions because that was a lot of new information about the policy and what's going on before we get into what you all can do. So feel free to put questions in the chat or to come off mute if Monique, if that's okay. They are not asking verification for homelessness. No. But I can't tell them. I can't tell them Carla's experiencing homelessness. Carla has to tell them herself. Erica.
Hi, yes. My question is, if when they were enrolled, they weren't experiencing homelessness, and in the gap of a year, whatever, then they became homeless, does that still apply to them? Or would they have to show some type of proof that their status changed?
If they weren't homeless before and they're homeless now, they just have to tell the county that they're currently experiencing homelessness. This is new, and so we don't know how the counties are handling this. And so you'll hear me talk about this a little later on. We need you all on the ground to tell us if this is going smoothly or not. And so as far as I understand, someone says, hey, I'm currently experiencing homelessness. I'm living in this shelter, or I'm in this encampment at this corner. Medi-Cal should restart their renewal. If the county is not doing that, we need to know about that. And so you'll hear from me a little bit later on about how we want to do that. If you Google for the question in the email on the chat that says, how can I find the current poverty level? If you just Google literally 2023 federal poverty level, it will break it down. Usually it's from someone in the government, AFCSM usually I think is what it is, but you'll see, it will tell you by family size, household, and the 100% federal poverty level. Any other questions or clarifications? Oh, ASPE. Thank you, Carla. Any other questions about the information we already started sharing? Okay, we will go to the next slide. So really what we want to talk about now is how you can help. So next slide after this. So there are a number of ways that people can renew. They can do it on the phone. They can do it in person. They can do it by mail, and they can do it online. So we'll talk about each of those. One of the biggest messages is whether someone is up for renewal this month, next month, 6 months from now. One of the big messages for you, for all your clients, is if they're on Medi-Cal, make sure they update their contact information. They will need an email. They will need an address, a phone number, whatever they have that they can update to make sure that Medi-Cal has their most recent information is really important. And if they have a mailing address, really important. And so one way you all can help is offering your address as a mailing address for your clients to receive their Medi-Cal renewal packets. We know this has happened in other communities where sometimes there's community centers who will let people get all their mail. We also know that there are some centers or providers who have limited the use of their address just for Medi-Cal renewals or other official documentation or official programs. So you all can make those decisions, but thinking strategically as a COC, how can you help all the folks? One of the biggest ones is make sure they get their renewal packet Or for many of the folks who are going to be automatically renewed because they're at this 100% poverty level or below, that they get that renewal notice and you can relax and you can go, oh, this guy's got coverage. I don't have to worry about them. Because what's going to happen is you're not going to know which of your clients have been renewed or not. And that a lot of work is going to be entailed in finding out someone is renewed. If you can share addresses, or they can have a family member or a friend give them their mailing address and they can get that renewal notice, the renewal packet, that's going to save a lot of work for them, but also for you if you're trying to help make sure people don't lose health coverage. If you know these 10 clients got an auto renewal notice and you don't have to worry about helping them keep their Medi-Cal because you know they have it for another year, then you could focus on the 3 clients who slipped through the cracks, who didn't have an address, who had the wrong address in the system, etc. So that's really like one of the biggest things we're telling our COC partners. For renewing, there's a number of things you can do. Originally, when we first started giving this advice, we're like, call Medi-Cal, tell them to ask them to check to see if you're eligible for automatic renewal, tell them you're experiencing homeless, do all the things that we just talked about. But right now, the waiting period for a phone call is really long. Some communities, it's not as long as others. I don't know what the length of time in Riverside, the wait period is. If someone knows that, feel free to come off mute and share. Like, is it long? Is it short? We can talk later about how to find that out for your COC. And then in person also is long wait times. And so that is a good way and a fast way, because while you're on the phone or while you're in person and your client is currently experiencing homelessness, they can immediately renew, or they can restart the renewal period. So those are 2 really quick, easy things when you've got captive audience of your Medi-Cal staff person. But because those waiting times are so long, another way to help your clients is through an online account. So some of your clients might already have online accounts, and some of them may need to create online accounts. And so what you'll have to do is sit with them at a computer and create an online account. And the thing they need the most is an email to create an online account. And we've heard from providers and other trainings we've done, don't give them your email. Help them create their own email. Because if you give them their email, then you're going to be getting all their notices for them, and they really need to get those. You can always be someone who can help them through that email find things and discover their renewals, but it's not helpful. Hopefully they all get housed and they don't have relationships with you anymore, but all their email is coming to you for their Medi-Cal. So you don't really want to do that, but you can help them get on. If they don't have an email, help them figure out how to get an email. For those who already have a Medi-Cal account, if they're already on, they've signed in, it will tell them when their renewal is. It will tell them your next renewal date is March 2024, or your next renewal date is January 2024, or your next renewal date is December 2023. So for folks who already have an account, it's a really fast way to find out when their renewal date is. And you can, update their contact information, provide a regular mailing address if one's not already in their account. So that's a really great way to do it. If they don't have a Medi-Cal account, you help them set it up. And it's supposed to be that after an hour or 2, their account is synced to their Medi-Cal information. And if you go back in an hour or 2 and look on their account, you will find their renewal information. So if they already have an account, the first thing you'll see at the top of their page is a renewal message that says, here's when you need to renew. If they don't, it may take a couple hours, maybe the next time they visit with you, you can go back on if it doesn't happen right away. They can go online themselves on their phone to find out when the renewal date is. So right now, I think the biggest message is see if you can get on their Medi-Cal account and find out when they need to be renewed. You might also see, congratulations, you've been auto-renewed after Friday, because there should be a notice or a message that they've been auto-renewed. I just want to remind you that every group of people is renewed at a different time period. It's not like everybody happens all at once. So every month, a different group of people are being renewed. So you might be working with people who are supposed to renew in September. You might have people that you're working with October, November, but all of you can help people update their contact information today, even if their renewal isn't going to be until January or February, to make sure they will get their renewal notice in the mail or the notice that they already are automatically renewed. So like the big campaign right now is get in there, update their contact information, find out when their renewal comes up. Next slide. So there are ways to help people in Riverside. This is your Riverside County Department of Public Services, which is the county Medi-Cal agency. The phone number is right there in the slide. And there are a number of local locations because you're such a big county. So when you get the slideshow, you can go ahead and click on Riverside County and it will get you to all the local plans, all the local offices. The other way to do that is you can see at the bottom, it's kind of covered by the PowerPoint, by the visuals, but keepmedicalcoverage.com, all keep Medi-Cal and coverage are all capped. And I think if you put org, it also gets you to the right place. That is a website DHES has that allows you to look at the left-hand column will say, find my local Medi-Cal office. It has the list of all the counties. You click on Riverside and right there is you'll see all the Riverside County locations. So that's a really good place to have it. Oh, thank you. We check this before we put in here. That's great. So the other thing is every county has a list of health enrollment navigators. They provide for free help people to apply or renew their Medi-Cal coverage. And so in your county, it's Catholic Charities. And then also the county public services, social services department also provides navigators. You also can find out that on the keepmedicalcoverage.com. If you click on that, it says find help near me or something like that, find help. That will allow you to click on Riverside County and find all the health enrollment navigators who are there. Next slide. One back. There we go. So like I said from the beginning, DHCS has been doing a great job. They have beautiful, accessible materials that help people know about renewals, and they all rely on regular mail. And so Homebase created a new set of materials, and you can go to that website. We also have another website that gets you straight to our materials, but we have a healthcare website, and then you can also go to our Medi-Cal renewals. Carla will put the Medi-Cal renewals one in the in the chat. And these have been written exclusively for helping people experiencing homelessness. They go in depth about these topics I just covered today. So they give you a little bit of background on Medi-Cal. They give you step-by-steps, how to renew, strategies, how to renew, links to your the list of Medi-Cal county offices, links to get to the health enrollment navigators. So they're quite extensive. They're written for providers. And then there's a set written for people experiencing homelessness. And so our goal is for you to not only use the ones to help you and your staff help people, but to have street outreach staff, case managers, housing navigators share the ones that are written to people experiencing homelessness for them so that they know how they can renew, so that hopefully they're written in 6th to 9th grade reading level, that people don't always need you all to help them, that they can do that renewal themselves. So that's packet of materials is really important. We also have this screen that if you put your camera up to, you can find the registration with the QR code. And we have a webinar that's going to go more in detail. DHCS is going to be on talking about their special rules and what their hopes are for people experiencing homelessness. And we're going to have some guest speakers who are going to talk about some of the successes they've had at doing a campaign to make sure people experiencing homelessness don't lose their Medi-Cal. And that's next week on Tuesday, October 3rd, 12:30 to 2. It's free. We have over 500 people already registered for that, and that tells us this is a big need. So, I said earlier, you can take that front flyer, that front slide that I showed, and take it to your staff. It also has the webinar on it, so you can use that to tell your staff you all should be going to this webinar. And then the other thing that's really, really important, and this I mentioned a little bit, is we need to know how this is going, right? We need to know, do you have people you're helping who are not auto-renewing, who are under 100% of poverty? We want to hear about that. We are in a good position right now that we have a deep relationship with DHCS. They are trying to do the right thing, but if it's not working, they won't know about it unless you tell them or you tell us. So the Medi-Cal at homebasedccc.org, we're asking you to tell us how things are going. When you and your client get on a phone call together and you reach Medi-Cal and you say, hey, my client is experiencing homelessness, but you have your client on the phone with you because DHCS or Medi-Cal won't talk to you about your client without your client there. You get on a 3-way call or you call from your office and you say, hey, my client is experiencing homelessness. Can you please restart their renewal date? And they tell you they're not allowed to. Document it. Who did you talk to? What county office was it? And let us know. If they do it for people, most of the people you talk to, but not everybody, we need to know who isn't it going well with. If one caseworker is doing it well, but then you get a new caseworker and they're not doing it. If one county office is doing it well, but a different county office isn't doing it well, we'd like to hear about it. DHCS wants this to go smoothly. They don't know, and they don't have the relationships with COCs the way that we do. And so we're asking you to share everything you can with us about how it's going at that Medi-Cal at homebasedccc.org and telling us how it's going. We had one staff person in a county who said she opened up the renewal packet and it was all out of order and the numbered pages weren't numbered right. And so she couldn't make heads or tails of it, let alone her client who had, was experiencing homelessness, had enough insults in their life, figuring out this packet, it was easier for them to put it in the trash. And so, of course, we had to say something to DHCS about this. Make sure that these are in the right order so that people understand how to use them and how to walk through them. So we're asking you to tell us when things aren't going well, but you see here, we also want to hear your success stories. We want to be able to say, Riverside County is on the ball. They've enrolled this many people, or et cetera, et cetera. I also want to hear creative things you all are doing. I was on with one of the counties that we did a presentation with, and one of the providers said, hey, let's do a 2 or 3 day kind of fair and tell all our clients that if you come into our office Tuesday, Wednesday, Thursday of this week, all our staff, all hands on deck, will do renewals all day for the whole day. If you want to get your address updated, if you want to update your contact information, find out when your renewal date, have help signing up for an online account. We'll do that with you Tuesday, Wednesday, Thursday this week. On the call, the local Medi-Cal office was on and they said, that's a great idea. You know what we're going to do? I'm going to send my caseworkers on site those 3 days and help people renew. That was kind of a big deal. We haven't heard if it actually happened yet, but these creative ideas, what can you do to streamline this process, make it easy for you all to do this in an effective way and ensure that the folks you're serving don't lose their health coverage? Okay, that's me. I'm done. Questions, comments, creative, thoughtful, interesting ideas that this has popped up for you, worries? It all makes sense? You're all gonna go off and do this? I see one thumbs up for that.
Elena, did you have your hand up?
No, I was trying to do a thumbs up.
Okay.
Wendy has her hand up, I think. Wendy, do you want to come off mute? Maybe it was a thumbs up too.
Well, I'll say something. Julie, thank you so much for all the information. I'll take myself off. There we go. Thank you so much for all of the information that you've provided. It's going to be so helpful. One thing that I wanted to share and caution is when we're making online, giving our folks online access to the any sort of like social security, I know is a problem. Make sure to write down the passwords and the username that you created for them. If they have a phone, try to put it in their notes section, because what tends to happen is we assist our folks and then a year goes by and they need access and they can't get back on, and trying to get them back in there is even more difficult. So just be cautious when you're assisting our folks get any sort of online access to anything. Make sure that they have the passwords and whatever else you used, so that they don't have even more difficulty next time around. Thanks again, Julie.
That's a hugely really good point. I really appreciate you saying that. And we have that in our materials as well. And we've raised that with DHCS, that this is a different experience when you're working with people experiencing homelessness. Oftentimes they have burner phones that their phone changes more than once or twice a year. They don't always have emails. They don't remember their passwords. They don't have a place to keep those passwords. So we've tried to share that information. I think it's a learning curve to try and help people understand this particular population is different. When I used to be a Medi-Cal, I used to do Medi-Cal policy, and whenever we would ask for, if people didn't have an address, they could just put a PO box or they could get an address from someone else. And that was the extent of the conversation about how to serve people experiencing homelessness, finding an alternative address. And now that I'm doing this work, it's much more than that. And it's, the unique experience of people who don't have a home and, have very little continuity in their lives. It's different. I think we've asked them not to require an email in order to sign up, to just use a phone. And I think technically that's really hard to just limit it to a phone. But we have started to help them understand what it means to walk in the world as homeless and try to keep these benefits. Also, we'd love your feedback on the fact sheets. So if you read the fact sheets and there's a tip that's missing from there that you think would be good, or something that doesn't resonate for you, we take any and all feedback. So keep us in mind. I know we're doing a whole bunch more of these in Riverside in the next couple weeks, because we have different groups that we're doing. The others are a little shorter than this one. But I really appreciate all of you attending today. It's a lot of you, so thank you so much. I'm glad. I'm excited to have so many of you on and to get that message across. Monique has the slideshow, and I would really encourage you to share that first slideshow, that first slide with your staff, and at least as soon as possible get them if they want to get on the webinar, because it's on the 3rd, which is next week. We've been doing this for a couple months. And all of a sudden I realized, oh, shoot, we don't have the webinar after next Tuesday to get out to all the rest of the staff who don't come to these things. So this is a good time to reach you, to make sure that all your staff get a chance to hear about this. And I will also say that DHCS really appreciates this important connection to people in COCs who don't normally get connected to these this Medi-Cal information, and to know that you all are on board trying to help your clients. So thank you all for all your work that you do.
Thank you so much, Julie, for that. And then thank you, Amy, for chiming in. And then again, folks, if you have staff who weren't able to attend the webinar today, they are also presenting. And again, Julie, thank you and your team for presenting at our Youth Advisory Committee meeting this week as well. That is for all of our youth providers. I know that a lot of our youth also are Medi-Cal recipients and also are experiencing homelessness. And so even for our youth, right, filling out Medi-Cal and those types of applications are already difficult and pose barriers to them as well. So our hope is that maybe we can find tips and tricks and ways to help our young folks as well. So thank you so much. So again, folks, if you missed it, you can catch this webinar and presentation again during our Youth Advisory Committee meeting this week. And then I know you all heard from Amy a little bit earlier. Amy is on our COC team. Amy, I don't know if you want to introduce yourself. I know that you've been working on some of these items as well in regards to the whole person care. And so I don't know if you had any additional information that you wanted to share with folks or introduce yourself in case folks had any questions as well. Just wanted to give you that space.
Hi, Monique. Thank you. Hi, everybody. I'm Amy Primrose Puente. I'm a program specialist here at Housing and Workforce Solutions. I'm the HIP project manager, and I'm doing some other things. We're kind of reshuffling over here. But I just wanted to say hi. Thank you, Julie. Everything. I'm just so happy that you came to share this with our COC, because this could be a showstopper, for we're in the streets and providing services, and no health insurance, can really be a barrier. So thank you so much. And thank you everybody for taking the time to get this information. And thank you for everything that you do.
Thank you, folks. Our next webinar will be Thursday, October 24th. And then after this meeting, we will send out the webinar recording. It will be posted online. In the chat is also the Google Drive to find the presentation and the PowerPoint slide. So please take a look at that. I can also include an FAQ from the questions that were asked in the chat, along with the responses. And then if anyone has anything else, feel free to email us at coc@rivco.org, and we will go ahead and end there. Thank you, folks, again for hopping on and making this possible. And thank you to our amazing presenters and all of the awesome information that was shared with us today. And I hope everyone has a great rest of their day. Thank you, everyone.
Thanks, everyone.
Bye, folks.